Australian health authorities seem to be taking a page from the FDA here in the US and are now pushing to combine millions of COVID-19 vaccinations with the flu shots in the coming months ahead. The only silver lining here? Well, at least it doesn't appear to be mandated just yet. That is the subject of today's episode, and so, from Trial Site News, I am Adrian, and our episode is starting right now. So, Australians vaccine experts are now once more calling for a mass vaccination scheme. The Australian Advisory Group on Immunization is recommending a fifth COVID-19 shot for everyone 65 years and older, as well as younger adults who have medical comorbidities, disability, or complex health needs to get this latest round. Apparently, as the influenza shot season approaches in Australia in April and May, health authorities are now suggesting COVID-19 could surge. And thus, reports of the push for the use of the bivalent Omicron booster to coincide along with the flu shot in the months ahead. Now this is, of course, despite the fact that health authorities just a few months ago went on the record saying that this wouldn't be necessary. See, back in November, just a handful of months ago, Mark Butler, a Minister for Health and Aged Care, declared that the Australian Advisory Group on Immunization decided against a recommendation of the fifth dose of the vaccine after, quote, considering international evidence as well as the local data. Among the evidence that they cited, the Australian Advisory Group on Immunization pointed out that in Singapore, it appeared that those who had received 2 doses of COVID-19 vaccine had very low rates of severe illness and death. But in December, the Prime Minister, Anthony Albanese, hedged his bets and made it known that he would defer to health experts for any changes. This naturally would open the door, and quite recently, a University of Sydney infectious disease expert, known as Professor Robert Bowie, went on the record saying that the durability of the last booster shot given to the elderly and the immunocompromised was, quote, wearing off. As he put it, I think it's pretty straightforward. To be honest, we've got winter coming. We've got waning immunity against Omicron. We've got vulnerable people who haven't had a booster for 6 months, and a minimum once-a-year booster is appropriate at the moment that could be delivered in April and May at the same time as flu shots are being rolled out. And so, surprise, surprise, we now have a push on to roll out another booster shot for the folks down under. But how effective will the current vaccines be? At present, cases of COVID-19 are down in Australia, with an average of 6,500 cases per day in January. This represents a substantial drop from 15,000 daily cases reported back in December. According to New South Wales Health, the decline in COVID-19 cases also corresponds with less hospitalizations and ICU admissions, while a highly mixed group of variants circulates around the country, including the BR.2 variants as well as XBF. Last month, reports in Australia suggest the emergence of Omicron subvariant XBB.1.5. And as you would expect, there was the obligatory hair pulling from unnamed infectious disease experts. The new variant was described as highly contagious and rapidly spreading across the United States, with a very small number of cases emerging in Australia. Maria Kirchhoff, the World Health Organization's COVID-19 technical lead, described it as, quote, the most transmissible subvariant that has yet been detected. The caveat to the ease of infection, though, was at the time of its reporting back in January, there wasn't enough data to know how severe its impact would be. Which then brings us back to the question, how effective will the current COVID-19 vaccines be against these mutated variants of Omicron? Is it safe to administer both flu and COVID booster at the same time? What are the longer-term health impacts of 2 primary series boosters and 3 booster doses? This latter point hasn't been studied at all. We just don't know. Now, regardless of this, the 5th COVID vaccine dose will be made available to adults in Australia soon. As of now, additional booster shots will not be provided for those under 18 years of age, except when they have health conditions that would put them at risk, given the low incidence of severe illness and high level of hybrid immunity among this group. And perhaps the one silver lining here is that for now anyway, the government in Australia isn't requiring or mandating that their citizens take this latest shot. But after seeing these past few years of Orwellian authoritarian tactics against their own citizens, color me skeptical. See, for those who may not know, as the COVID-19 pandemic progressed, the Australian officials became obsessed with keeping new infections at zero in their country. This was evidenced by strict curfews and lockdowns in all 6 states of the country. These lockdowns were the strictest in Victoria and South Australia and were usually introduced overnight and without prior notice. They had travel restrictions, which were first introduced only on international travel by non-residents, which were eventually extended to encompass interstate movement and then international travel by Australian citizens as well. For example, in May of 2021, the Australian federal government banned Australian citizens and permanent residents in India from entering Australia to curb the spread of the Delta variant of COVID-19. To enforce these travel restrictions, the Australian government threatened its own citizens with jail sentences and hefty fines. And then in August of 2021, further restrictions introduced on international travel meant that Australian citizens were not allowed to travel to any other country without the permission of their own government. Why? Well, aside from a hungry power grab, the answer doesn't seem really clear. The official line is that banning its citizens from leaving the country was part of their COVID strategy. Sounds like nonsense to me. And yet it still happened. Australian state governments also employed mass surveillance under the pretense of curbing COVID-19. For example, South Australia introduced a surveillance app that monitors returning travelers quarantining at home through facial recognition and geolocation features. The state government would send these people in-app texts at random times, and they would have 15 minutes to reply from their designated location. And if you failed to reply, well, get ready for some police intervention. Additionally, the state of Victoria had also suspended the state parliament at various points during the pandemic. The state parliament, mind you, had continued to function during both world wars and even during the Spanish flu, but it was suspended this time around. The state premier, Daniel Andrews, while explaining the reasons behind the closure of state parliament, lamented that it is not about human rights, it is about human life. Funny, isn't it? Rights don't matter as long as your life is protected. The communists in China would certainly approve. And speaking of the communists in China, the Australian state and federal governments also at various points deployed their own military to enforce curfews and lockdowns, break down anti-lockdown protests, and arrest dissenters. If the disregard for civil liberties, key democratic institutions, and mass surveillance were not enough, the act of deploying the military to quash dissent alone shows the extent to which Australia embraced repressive and dictatorial tactics to manage a public health issue. The mindset with which Australian officials approached COVID-19, by arbitrarily suspending important freedoms and civil liberties and wanting its people to comply without question, is beyond concerning and shows the fragility of democratic ideals within the country. A problem, by the way, that seems to be festering everywhere these days. And that, my friends, will bring our episode to a close once more. For more content like this, be sure to check back to this channel daily, Monday through Friday, or for written news articles every day, 7 days a week, feel free to check us out at trialsitenews.com. As always, my friends, thank you so much for joining me on the program today. From Trial Site News, I am Adrian, and I will see you all